All right, we're back on the Rob Dibble Show with Ben Darnell and your afternoon drive live from the Travelers Radio deck, brought to you by Big Y. And joining us on the set, one of our favorite people, Dr. Robert Waskowitz, Orthopedic Associates of Hartford. And can I just call you Robert?
You can call me anything you want.
I mean, I'm only 4 years younger than you.
I'm calling you Doc.
All right, I'll take
that.
that.
You're young. You have to respect your elders.
Either way.
But Robert, all right, so when you're out here, I mean, you're doing a lot of different stuff and things like that. These guys are in play. They've got 4 rounds to try to make $3 million. Is there any more pressure on your assessment of some of these guys, these athletes, to send them back out there? Because you can't, rehab them if they get injured, hurt a hammy or something like that. So what's it like when you consult with a golfer that's in the middle of a tournament?
Establishing a relationship and knowing that we're there for support. So they're going to come to see us to try and manage a current problem and to keep them active. We want them back out the next day and the next day following. So when they come and they have a complaint, our job is to try and support. I think one of the most important things is to listen to what their complaints are, because they know how to manage. They're pros. They've been doing this forever. There's no difference from them competing today than when they're on the driving range, because if they get injured on the driving range, that's going to shut them down for their tournament. Part of our job here is to listen. What's your complaint? How can we try and manage this? Management is the key.
Dr. Waskowitz, part of the Orthopedic Association of Hartford. Just these guys, though, are all independent contractors. When you deal with teams, you got to deal with possibly owners, probably coaches, and most likely parents if it's under 18, and then the player. Around here, it's just the player. Maybe. I don't know. Is that right? And is that easier or harder to deal with?
It's a different variation. Same theme, different variation. When we're dealing with a team player, yeah, you're dealing with a bigger circle. It's an onion, essentially. Too many layers that you have to deal with. These individuals, it's them and them alone. So
right.
that I guess intimacy that you get, and you can establish that, it's that much more important. If you're on a team, you have your other teammates that can step in and play. If you're solo, it's you or no go. So there's an acuteness, I suppose, that we have to deal with these guys. They come in, it's them. They need to get out here. Otherwise, they're going to be going home. They're not going to be able to play. So it's the acuteness of the injury, and again, establishing that relationship so that they know that you're there for support.
All right, so I've been doing this for 9 years from here. I remember when there was just a tent for the athletes. Now you've got trucks. You've got rehab trucks. You've got therapy trucks, things like that. Describe what the setup is now on tour and here at the Travelers.
Right, so think back when it was the GHO.
Okay.
My dad used to take me. He worked for TIC.
So what was that, 1952?
Yeah.
Right. What did they have then?
Not a lot.
Not a lot.
Not a lot.
Probably out of a car.
Right. And if you found a ball, you were playing with that ball. So the evolution of what we've seen here is tremendous, and it is at the top of the game with these guys. What we've done from a medical standpoint with the PGA is patient support, player support. We have 2 trailers that the players can come to. One is a rehab trailer, the other is a treatment trailer. So if they're coming in with an injury, rehabbing from an injury, get injured on site, the PGA has provided a staff. The athletic trainers here are hard workers, and they do a professional job. So that's one of the tents that we have, one of the trailers. The other trailer is rehab, and these guys will go in there and work out. And they start early in the morning, and they'll end. So today is coming to a close, right? Day is not over for them. They're going to go to the rehab tent and try and rehab and get ready for the next day.
Explain what's in those things. I mean, we're talking, when he says trailers, ladies and gentlemen, we're talking about tractor trailers, semi-trucks that are pulled in here. They used to be in front of the clubhouse, but like Dib said, the whole place is expanded.
And the sides open up. I mean, they become like a building.
RVs with pop-outs. What do I see when I get in there? What other kind of equipment do you actually have available here on the course?
Think of professional. Think of what an individual expects. It is the top-of-the-line equipment. It is the top-of-the-line treatment, from percussion guns to ultrasound to heat to stim to trainers. We've got stationary bikes. We've got all the bands. We've got treatment rooms, essentially, where that individual can come in. So it's not as if they're going to a trailer. They're going to a treatment center, and it literally is state-of-the-art.
Let me ask you about yourself as a doctor, your 3rd generation. Tell me about your grandfather. Tell me about your father. What got you interested in medicine? Did they allow you to watch surgeries when you were a kid and things like that? What got you, I can't wait to do this?
Yeah, it's a privilege. It totally is a privilege for me. And I consider myself one of the luckiest guys on earth. I had great role models in my dad and my grandfather, 3 generations in the same town, so that probably covers 80 some odd years. I still have today patients who will come in and they'll shake a crooked finger at me and say, your grandfather delivered me, your father took care of me, and now it's your turn.
Awesome.
Yeah, so it's truly a privilege.
Awesome.
You know, I got into it. I took an indirect route. I was not on the straight and narrow with this. I needed to get some life experience first. So I went a lot of different directions with the undercurrent that I'm athletic. I like taking care of active individuals, and I like solving problems. So for me, it was always, what can I do to try and help? To your point, Rob, you'd asked about surgery. Surgery to me is a tool. It's not the first tool I reach for sometimes. So this idea of rehab component is really important to me because not everything is surgical. The other variable that we've had this discussion before, the other variable is the mental side to it.
Right.
So I'm seeing so many young athletes, 12-year-olds, 13-year-olds, who have significant injuries, and then they're facing this whole mental challenge. So it's a very delicate balance, but I'm passionate about
A
it.
gentleman just came up to me because, of course, I coach AAU baseball, 8 to 18 guys. I have 5 teams myself, and his 10-year-old son tore his ACL.
10
I
years
mean,
old. 10 years old.
that breaks my heart. It really
Yeah.
does, because 10 years old, I mean, I got hurt when I was 30.
Right.
I mean, we're really pushing these kids.
So think about that. If you have an injury at that age, and whether it's a surgical reconstruction or treatment, we anticipate that we get that individual back to the field
Absolutely.
of play, right?
Yep.
So they're 10 or 12. What happens when they have their next injury, when they're 15 or 16? We do the same thing. What happens when they have their third major injury to that knee or that shoulder or concussions, and then they're facing this lifespan of limited sports approaches?
Right.
That's the mental side.
Best orthopedic that we know here in the nation, and part of the Orthopedic Association of Hartford right here for all of us to enjoy. And the other thing, ladies and gentlemen, this guy has put himself through sports injuries just to treat you better. I mean, you tore your ACL,
Yeah.
you tore your Achilles, you tore your other ACL just to be a better doctor.
So
and that is some commitment.
Right, that's commitment on my behalf. But I'll tell you what that brings to the table for me is an understanding.
Exactly.
Right, I've been on that
And
side.
you're an athlete, too.
Been on that side, so I can relate. I know what you're going to be facing. I know the hurdles that you're going to have to jump through. I
Right.
know it's really, really a challenge. So that's an opportunity, again, establish that relationship.
This first-round pick, we were talking about this off the air, 7'5" kid, Webiyama. What does he face as far as trying to keep this guy on the basketball court for like 15 years? We've seen Zion Williamson and multiple injuries. We've seen, other guys. I'm old enough like yourself, Sam Bowie, all these other guys. When they first came out, oh my God, this guy's going to be so great, and then he has nagging lower leg injuries, things like that. Not easy to be a 7'5" human, is it?
That's a big frame. It's a big frame, and it's one that needs to be finely tuned, particularly at the professional level, whether it's a baseball player or a basketball player or a football player. You have to tune up. You have to come into it. Let's face it, he wouldn't be there if he wasn't an athlete, right? So we know that he has the gift. Our job is to try and minimize that risk point, and that's where it comes into play. Does size matter? Is this something that's really important? If I have a 7'5" pitcher versus someone who's 6'1", what's the difference? Well, the mechanics are still the same, but you're putting more force on the mechanics. So with that pitcher, and if he's got that wingspan of almost 10 feet versus an 8-foot wingspan, the mechanics are a little bit different with that because the force, the physics behind that puts soft tissue at risk. So in his position, or any large frame, we look at those things you need to maintain: range of motion, stretching, and strengthening. And if you come in with a problem, that's only going to make it worse.
Does he have like his own team though? Like when he gets there, it's like, okay, listen, we need to stretch you out. It's a lot of preventative medicine for this kid the rest of his career.
They're going to do an evaluation. They're going to look at positives and negatives. They're going to do their pre-participation evaluation. What's your rotation of your shoulder? What are your strengths? What are your weaknesses? So he's going to be so finely tuned and dialed in that they're going to know, okay, we need to work on this section. That part's pretty good. This is where we're going to focus on. So that team approach is a personalized approach. And that goes from the top down, from the athletic training staff to the team physician to the support staff. So, yeah, he's going to get that evaluation. They're going to know where he stands.
All right, you've heard this mentioned. It's kind of a phrase on the show, the Chris Sale diet, meaning like all these skinny mini athletes out there. I'm going to throw Will Zalatoris in the mix as well, as he's been coming off of back surgery. Wembanyama fits my bill for being on the Chris Sale diet. And he was asked this by Jay Billis last night. Do you plan on bulking up? Do you have to bulk up? And he said, I plan on getting my core as strong as possible. What are your thoughts on just bulking up for that wear and tear? Is that a necessary thing for an athlete?
Bingo, you said it, core.
Core
Stability is the foundation, and you build everything on your foundation. So if we look at our competitors here, smaller frame, not a lot of meat on the bone.
Chris Sale diets.
Okay, Chris Sale diets. But it's from a diet standpoint, it's what you put in,
right?
That's what you get out. So as long as you're eating a healthy diet, a well-rounded diet, you don't necessarily need to bulk up. That machine is so finely tuned that if they add a pound or two to that frame, it's going to alter the mechanics. So these individuals come in, they know what they need to do to put in. You don't necessarily have to bulk up, because the gift that they have is their technique. And there are a lot of things that you can't teach. You could send someone to the weight room and, hey, we're going to bulk you up, we're going to put on 20 pounds on your frame. That's not going to work. It's the technique. So if you can maximize the technique, get your evaluation, go to the throwing coach, make sure that your arm rotation is good. That chain, kinetic chain from the hand to the foot, needs to be maximized. So the frame is important, but it's not necessarily the bulk.
Talking to Dr. Robert Waskowitz with the Orthopedic Associates of Hartford. Give me some injuries out here that these guys face all the time that we might not know about golfers.
Right. So an acute injury on a golf course is a rarity. There have been a couple of times. I remember a couple of years ago, one of the guys put it in off the fairway and was backpedaling and dislocated his ankle.
Is that Finau? Tony Finau.
Tony Finau? Yeah.
Oh, so, wait, were we not supposed to say that?
No, you're not supposed to. So
it wasn't Tony Finau.
It wasn't Tony.
So my point, the acute injury is a rarity on a golf course.
Right.
It's more the chronic things,
right?
Repetition, overuse. So we're seeing a lot of shoulders, elbows. The big thing now that our focus point on is backs, lower back, right? So that's part of the foundation. When we have our players come into the training room, we're really focusing on that core stability. So if I had to say what are some of the most common injuries that we see from golfers, it's overuse. I see a lot of shoulders, and it's basically the low back issues that we have to deal with.
But you just took the words out of my mouth. Overuse. Dude, we're sitting here by the practice range. These guys
are nutty.
They have a golf problem. They're addicted to the game. If they lose it all, they're going to be out here even more than what they were in previously. And you say overuse to us all the time, especially when Dibbs is talking about his youngsters. How do you keep guys, like, is there a limit, like with pitchers, we kind of think of the 100 mark for pitchers on a start. Is there a limit that you would throw out there for golfers? Like, listen, man, 14 days in a row, you're cruising for a back injury.
Golfers are a different breed, and they know their body. They know what their tolerance is. And if they're going to be playing a tournament here, 3-4 days in a tournament, where are they early in the morning? They're in working out and stretching out. Where in the afternoon? They're fine-tuning their skill shots on the tee and on the box. So they know what they can tolerate, and they know their limits. When they start to feel that they've overused that engine and the muscle group isn't responding well, it may be a simple backswing. And they know, hey, my shoulder turn's not good enough, shut it down, because that's where the risk goes up.
Let me ask you about the cool down. This is my final thing for you. I know we've kept you a long time. But,
we do this all the time, too.
I played 13 years professionally. After every day, you would stretch out again. You wouldn't just walk off and go into the locker room, take a shower. You stretch out again. You're focused on your legs and your back and stuff like that. Is that something that athletes? I don't see my athletes do it, but is that something athletes should concentrate on? Is doing a little cool down?
They better do it. So I'll bark. They better do it, because that warm-up is key. Warm up the engine before you're going to get out and compete.
Yep.
There has to be a cool-down phase. So that cool-down phase, this is a pretty interesting topic. If you're going to use the engine, it's going to loosen up. You're going to go through your mechanics. You're going to feel pretty good. At the end of that, if you just shut it down and go to the locker room and don't do your post-game stretch, things tighten up. And if it tightens up and you're going to try and compete the next day, whether it's at an AAU level, whether it's at a Pee Wee level, whether it's a professional level, we have to understand that there's always got to be the warm-up, but just as important is the cool-down.
All right, we got a field of about 150. How many out of these 150 are masking pain, masking injury, not telling anybody about it, and just going through the 18?
I would say very few.
Yeah.
To be honest with you, I'd say very few, because they wouldn't be here if they had an injury, and they're smart. They know that if they're going to not confront that injury and they're throwing themselves into risk, that's going to affect not just their tournament play today, that's going to affect the next 3 months. Because if they are unable to be on the field or on the tee box doing what they need to do, they are the smart ones on the field. We're here for support.
Robert, thank you so much for your time. We'll take a quick break. We'll be back here live from the Travelers Radio Deck, brought to you by Big Y. It's Rob and Ben. We'll be right back.